We started this circle because, in my opinion, there was a gap in the education of the general public, and certainly reflecting my background in the military, a recognition of people that suffer from mental health, because it doesn't usually show physically. And in this case, you could have a lot of people that have a mental health problem, and nobody really knows about it, and they're scared to come forward. It's designed to advertise the fact that somebody is interested. The circle is, we started that when I was installed, or shortly after. It took a while to get up and running, but we got some very competent people involved in it. And it's really to try and reduce the stigma of mental health. Stigma meaning that I've got a mental health problem, and I've done something about it. Others can do the same thing. Come forward, look in the mirror and say, I've got a problem. And seek professional help if necessary. Well, I take it personally because I spent a long time in the military and saw some horrific things. And then when I did get out, I was involved in humanitarian efforts in Africa and so forth, and once again saw some horrific things. And then I carried on, but it was starting to affect my lifestyle. I developed some bad habits, drinking, gambling, and so forth, and it was affecting my family life. The fact remains that I had to do something, and that's when I looked in the mirror and said, you do something, and that's what I did.
I'm glad to be here, able to talk about the issues of the stigma of addiction and mental health. Having been an addict for 21 years of my life, I know the stigma well. I've traveled through recovery feeling like many people looked down at me and chose to see me as other than a human being. Addiction is not an easy process to recover from, and I've been in recovery now 26 years of my life. And I've had the amazing times where I've reached out and done things in my life that I never expected would happen. But as I looked through my life of addiction, I knew two things: guilt and shame. Guilt to me is one of those things that I see as guilt equals I made a mistake, whereas shame is more like I am a mistake. And I don't believe that anybody is a mistake. We make mistakes, but we aren't mistakes. We come into this world, we live our lives, and we get on with them. To me, the process of recovery and change from addiction is a long path for many of us, and one that needs to be respected. And I don't want to hide behind anonymity. I want to be able to say, yes, I've got a past, and I did a lot of things I regret, but today I'm doing things that are very positive in my life. Working with youth, I've spent the last 12 years running a charity that helps young people deal with addiction. And in the early stages, I didn't know everything that I know today about how to deal with them. And of the many young people I've worked with, many are still clean and sober and doing the right things in their lives. Sadly, we've lost a couple of young people along that path. And when I say lost, it's lost their lives. Addiction has that tendency to take lives, as well as mental health. To me, the brain illness that we call addiction has long consequences and is quite often comorbid with many other mental illnesses like depression. And to me, these are the parts of the life that an addict goes through of not understanding how to deal with their own mental illness. And to me, recovery is an amazing thing because we can go on and do great things in our lives. I've been a Rotarian for the last 17 years of my life in recovery, and I've been treated and respected by many members. I've had the odd one not treat me the way I would expect, because some people look down their noses at people who've been in trouble with the law or addictions. Most of our inmates in federal institutions and provincial jails with addiction problems have many issues that they need to deal with. but they're human beings still. They're not scumbags. They're not horrible people or evil. I look back at the way we label people in society, and around mental illness and addictions, the labels are horrible and need to stop. We need to begin looking at all people as human beings, no matter what's going on in their lives, and treat them as such. It gives them the opportunity to change and grow and become something better. In my life, I went from a really poor student in high school to an honors student in university, student president at my university, Athabasca University, and through a lot of other processes that have taken me to where I am today. I'm Volunteer of the Year in 1994 with the United Way, and a lot of other areas where I shared my experience and hope of change with all kinds of people. My life today is running a charity, and in charity work, we see a lot of people don't understand how important it is. A program that deals with addicted youth or youth in trouble and at risk gets looked on as bad kid programs just because we're dealing with mental illness and addiction. And they aren't bad kids, they're just kids that have lost their way and need some help and a path to come back from. I look at our province today and I see two things. We spend billions on policing. 3.47 billion a couple of years ago was a stat I saw. And we spend almost nothing on treatment and mental illness. Mental health gets about 97% of the budget compared to 13% for addictions. We think that needs to change. The reality is today, treatment needs to be on demand. Kids can't wait 2 weeks, 6 weeks, 90 days to get into treatment. Neither can adults. When somebody needs to get clean and sober, they need the help right now. And that has been my belief for a long, long time. I've watched it happen where when we delayed because there wasn't any beds for treatment, we lost kids back to the street, and adults, young adults, just moved back into their addiction. We need that, and not just 19 days as one of the organizations in Alberta does, and I don't like to point fingers really badly, but we need 90-day minimum treatment, and we need to put the funds into it. What we put in advance, we will gain at the other end. But I think in many places, people are short-sighted about spending more on the mental health of young people or the addiction problems of young people. Today, standing up for those young people is an important thing in my life, and I will do it until I can no longer get out of bed and come and do things like this. I don't look forward to a pension or any of the other things that many people have got, because I lived a sad life for almost 21 years before getting clean. I look today towards trying to change the way things look in our community and changing the way we deal with addictions, changing the way we deal with youth, and focus forward on good educational preventative processes so we don't need as much treatment. And that's where we need to be. Students get less than 1 hour of effective coordinated curriculum in school around addictions in their whole 12 years. I think it needs to be a couple of hours every year. And I look forward to working with anyone who wants to move that process forward. And I'm really proud to have been part of this presentation today around the Circle of Mental Health and Addictions with our Lieutenant Governor. I think the Honourable Don Ethel is a forward-thinking person in working on this and having had his own experience. To me, this is the way we all go, is we do have times in our life where there's problems with our mental health, and many of us run into addiction, but we need a way out, and we need people there to support us. And it's been my pleasure, although it's not an easy job, to be part of that recovery process for kids and adults in our community. I ask that everybody think about this process. We need to end the war on drugs. We need to start changing the way things work, and we need to spend more on training, education, and assistance for youth in housing and ways to deal with it, along with really good parenting programs if we're going to change the way it is. Good education builds a future for young people, and good education includes learning about the tough things in life that are out there, not hiding it from them, as we've done so that many kids learn all the wrong things on the street through peer pressure. And for me, that's the way it got started. Today, through education, I believe that it is important we give them all of the knowledge so they can make good choices in their lives. I look forward to working with the Lieutenant Governor's Circle on Mental Health and Addictions in assisting in the growth and change of these programs in our community, and look to making the absolute best of a really hard problem.
Addiction has many faces. A famous individual once said, "It has a black face, it has a white face, or any shade in between." It occurs in people who are rich, people who are poor, people who live in urban settings, people who live in rural settings. Whatever the face of addiction is, it certainly is a face that you know. It's an individual next to you. It could be anyone. Addiction affects 1 out of 4 families. People come to my office very often with addiction, or a family member who's worried may phone and say, "I think this individual whom I love may have addiction." They're often devastated, they're humiliated. They often feel that they don't know what to do, they don't know where to go. They really don't know what the next avenue should be. They often get told that they're either crazy, stupid, or that they should be punished. Very often, people with addiction do not get the appropriate treatment that they need. Addiction is a condition that's often riddled by a whole host of problems, among others, the fact that we don't have a nationally set of guidelines that guide treatment in terms of addiction, at least one that is universally accepted and universally practiced. Addiction is one of our biggest and most salient problems of our time. It's the leading preventable cause of death, disease, and disability, and yet it remains grossly undertreated. We say that addiction is a bona fide, chronic, relapsing disease. It's a mental disorder. It's not simply a choice. Addiction is not a character flaw. It is not simply something people wake up with one morning and make a decision that today I'm going to smoke cigarettes, or today I'm going to smoke crack cocaine, or inject heroin, or drink too much. That decision is oftentimes long gone. So addiction is a chronic disease. How do we know that? The newest evidence emerging suggests that addiction has been demonstrated on sophisticated scans. On the bottom row, you can see that is an example when individuals suffered a heart attack. So with the appropriate and sophisticated scanning techniques, we can see that there's a demonstrable, visible change in the muscle of the heart. You can actually see the change in color. In the top row, you can actually see the change that occurs in an individual who is addicted. The brain of the addicted individual looks different to the individual who is not addicted. So addiction is indeed a bona fide chronic relapsing disease, as opposed to simply a choice or a character flaw. Up to about 5 or 6 years ago in the province of Alberta, mental health and addiction were governed by 2 separate ministerial commissions. We know that if an individual with addiction presented to the mental health system, they were often told, first go and fix the addiction issue and then come back and we'll deal with the mental health issue. And people presenting to the addiction facility who have a mental health issue would be told, first take care of the mental health issue and then we can take care of the actual addiction issue. So those individuals who had the nerve to have both disorders, namely mental health and addiction, which is the norm rather than the actual exception, those are individuals who often fell through the cracks, who were not able to access the appropriate level of treatment that they so deserved. One of the biggest causes of stigma is the fact that addiction is not always viewed as a medical condition. It has been demedicalized, and it's only in the last few years, based on the best scientific evidence, that we're starting to understand this truly as a medical condition that is indeed amenable to treatment. Viewing it not as a medical condition is one of the biggest causes of stigma to those with addiction. Earlier in 2014, a landmark study was released by the government of Alberta. The principal author on this study is Cam Wild. This study suggested that almost 50% of people with addiction do not receive the appropriate level or the appropriate intensity of treatment. Imagine for one moment that if 50% of people with breast cancer report that they do not receive the appropriate level of intervention or care, what an absolute public outrage that would cause. And yet, for people with addiction, we seem to accept that this is the norm. This is something that hasn't changed over the last few years, and people with addiction continue to be vastly undertreated. Different studies have suggested that about 1 in 5 people do not present for treatment because specifically of the barrier of stigma. One of the leading causes why people do not present for care otherwise or not receive care is the fact that they often cannot afford the necessary treatment. So unlike many other chronic diseases, addiction is not universally covered by the scheme of medical benefits. This means that patients often have to pay out of pocket for treatment. The message that it conveys is that addiction is not a disease and that addiction is a choice, and therefore you should be punished and you should face the consequences by paying for the actual treatment of this condition. All this contribute to further stigmatizing the condition of addiction. Canada is the country of all the G8 countries spending the least amount on mental health in its overall budget. Alberta is spending a small amount. Only 13% of the total budget of mental health and addiction is spent on addiction. And yet, addiction is the most common mental illness. It is viewed as the most prevalent, most lethal, and yet among the most treatable of mental conditions. Again, what this does is it perpetuates the actual stigma associated with addiction, not as a disease, but falsely, erroneously viewing it and labeling it as a lifestyle choice, and therefore not worthy of actually receiving funding. These are things we can change. A fellow countryman of mine, the late Mr. Nelson Mandela, said in his famous words, "Education is the most powerful weapon which you can use to change the world." These words are profound in that if we can help our decision makers, our governments, understand that addiction is a disease as opposed to a lifestyle choice or a character flaw, we can change the way in which this condition is actually handled. It is a condition that should enjoy parity in terms of funding as well as the level of attention. Failing to do that perpetuates stigma. Knowing how common addiction is, knowing that it impacts 1 in 4 families at least, and the fact that it is indeed still highly stigmatized, thereby providing a barrier against accessing treatment, the necessary next question is, what can we do to fight stigma? There's sufficient evidence to tell us what to do. It's not a case that we don't know what to do. But probably our biggest and best first step would be to stop paying lip service to the situation, to the phenomenon of addiction as a chronic disease. We should now start acting as though this is a disease as worthy as many other chronic diseases, like breast cancer, like arthritis, like diabetes and hypertension, as opposed to viewing this as the fault of those actually suffering from it. Addiction should be treated in the same way as what other chronic diseases are treated, and we should provide funding for the treatment of those conditions. We're one of the countries with the lowest amount of funding available for mental health treatment, but also with the lowest percentage of prescriptions for addiction-related medications. Where do we make this decision? How can we influence this? Well, our decision makers, those are the individuals who need to help us change the culture of non-attendance to this bona fide chronic relapsing disease. If we don't advocate for the change, who else is going to be doing it? I urge you to take the next step, help us fight the battle against stigma. This is the thing that will change the landscape. When people phone my office, they're devastated, they're hopeless, and they're helpless. Stigma is often one of the biggest barriers that they are facing to accessing safe and effective evidence-based care.
I'm here today to talk to you about the stigma around addictions, specifically from a personal perspective. I'm proud to say that I'm 5.5 years clean and sober today. So that's 5.5 years clean of experience that I have to talk to you about. See, the stigma around addictions that addicts face, I broke it down into 4 different stages for you to understand. And the number one being family and the treatment and the stigma around that. See, everybody has a perception that when one's going to quit their lifestyle, they're going to quit their addiction, they're quitting on their family, they're quitting on their friends, they're quitting it could be possibly their employment, depending on their employment circumstances. It's quitting a lot of things, and it's very difficult, it's very challenging. See, when I had to clean up, the thing I had to face was the fact that I had to quit on my family. For the number one reason being the fact that my family was the influence of my addiction. They were the influence of my lifestyle. Ever since I was 13 years old, that's how I was introduced, and that was to crack cocaine at 13. That took me on a 10-year spiral of various drugs, various crimes, in and out of the institutions, and it was very challenging. So when the point came, when I had to turn myself into treatment, I had to quit on my family. The friends that I made out there, I had to quit on them too. And you know how difficult it is when you are dealing with friends that are closer to you than your own family was? And when I had to tell them the fact that I was turning myself into treatment, they're like, "What, you think you're better than us?" And then when I was clean and sober, even for a couple months, they would ask me again, "What, you think you're better than us? What, you can't hang out with us?" It was very, very difficult. Now, for an addict that has sober family, and they're turning themselves into treatment, sometimes, well, that could actually be a very good influence for them. But again, depending on the circumstances, it could be very hard for the family to understand that, you know, there's going to be many, many changes for this individual to make. Let's say, for example, if the individual is working in a bar, but they're making very good money and they have a manager role, but yet when they go to treatment and when they exit that treatment center and they learn that they cannot go back to that employment and they have to start somewhere fresh, let's say on a minimum wage spectrum, the family might be, they might neglect that decision. So it could be very difficult for both family and for the addict. When I was in treatment, now I was in there for 28 days. I learned a lot about self-care. I learned a lot about my boundaries. I learned a lot about healthy boundaries. And I learned a lot about character defects. Now, when I learned a lot about this, I found out that I could not have friends that drank. I could not have friends that smoked weed. I had to have particular expectations of my friends. They had to have careers, or they had to have an education. They have to be sober. And those are just a few boundaries that I need in my friends, and that's why I learned from treatment. Now, to exit the treatment center and to establish those boundaries was also, again, very difficult. See, this transitioned into my employment barriers, which is stage number 2. The employment barriers that an addict faces is for the number 1 key is, when was the last time this individual has even had a job? If this individual, like myself, paid for all of my finances, paid for all of my housing, my food, clothing, all from crime and drugs, and I've done that for 10 years, and I don't have 10 years worth of work, or I don't even have a resume, how do I go forward to an employer and let them know and be open about my history and tell them I just want my foot in the door? I want my first chance when I'm 24 years old and I have nothing on my resume. It causes a very big challenge. A very big challenge that it was actually a full-time job looking for a job. It literally took me 1 month of persistent searching on the web, cold calling, interviews, getting declined on all my interviews because they seen right through my resume that I did not have experience. I did not have previous employers. Everybody shot me down. You know how difficult that is? To be going for an entire month, sobering up, cleaning up my lifestyle, and having no one giving me the first chance. Again, it's a barrier and it's a stigma that employers perceive on us. Just because I'm an addict doesn't mean I can't contribute to society. Just because I'm an addict doesn't mean I don't know something about recovery. And just because I'm an addict doesn't mean that I'm not working hard on cleaning up my life. Doesn't mean that you cannot give me a first chance for my first job. But it is very difficult. So when I was given that first chance, I made sure that I gave all of my time, my energy, my efforts into my employment because it was my first job. I moved up from that first job from being a basic laborer to a trainer. And from a trainer to someone that the company would always accept back. I had to leave because I wanted to get myself into school, but they always accepted me back if I ever needed to. My next barrier is educational. And I say educational because anybody that's in recovery, when they're an addict, probably about 75% of the time, they never did get their grade 12. So when they decide to clean up their life, they are going back to school. They're going back to school, they're chasing their dreams, their goals, their career, whatever that may be. See, what brought me back into my education was not only to receive my grade 12, but I also wanted to get into real estate. And I still do want to get into real estate. But the barrier I faced was when I was trying to be accepted into Concordia College, the facilitator told me straight out that she has a rule and a boundary. A boundary that if she knows of the individual that is an ex-addict, they have to be 1 year clean and sober before she's going to accept her or accept that individual into their program. At that point, I was only 6 months clean and sober, 4 months. But I was very dedicated, I was very persistent, and I knew I had the perseverance to achieve my grade 12. I wanted this diploma. And when I stated my dedication that I would apply into the program for her if she gave me a chance, she told me I had to do 3 things. One was to interview the person of my choice for a career that I want to get into, which is real estate. The next thing, I had to write a story or a bio about myself. And then following that, I had to set out a 5-year goal, or it was more or less steps into achieve those goals. So the mistake that I had was that I thought she said I had to do all three. The only thing I had to do was I only had to make two. I only had to make two of those documents in what I wanted to pursue. But I did all three because I did not know I was only supposed to do two. And I brought all my copies back within 1 month. And she told me, Jamie, I will give you a shot. And do not disappoint me. And you know I did not disappoint her. I actually graduated with honors on the honors roll, and I went out with a bang, being the graduate speaker of that year. I did not know that I could ever be on the honors roll, being the fact that I'm an ex-crystal meth addict, and I was hooked on crystal meth for more or less 10 years. So being an ex-crystal meth addict, and then cleaning up, and under my 2 years of sobriety, I achieved my grade 12 on the honors roll. I thought that was phenomenal. So again, I had to break through that barrier. I had to persevere. I had to never mind what my facilitator told me. And although that those were her rules, I had to understand that there would be a way around. And I found that way around. My next barrier that people face, it's in creating new friendships. Creating new and healthy friendships, I should say. Because being in recovery, we have to make sure that we look at ourselves as number one. We have to take care of our own needs. And the needs of being sober is on top priority. We have to make sure we're going to meetings. We have to make sure we have new friends that are sober, that are career oriented, that are into school. Whatever it is, it has to be positive activities. We have to make sure we have those friends. And it's very difficult to approach new friends, especially when you have a criminal background, when you have a drug history, because right there, you're labeled as a risk. No one wants to be friends with you because you're untrustworthy. It's very difficult to even, like if I were to engage in conversation with a stranger in my early recovery and they asked me what I was doing a year ago, well, that year ago, I was just getting myself out of jail. I was on probation, I was seeing a counselor, I was going to meetings, I went to treatment, but a new friend doesn't want to hear that. They don't want to hear that I'm an ex-drug addict. So it really doesn't create a conversational piece. And if you don't have conversation to engage with a stranger or a new individual that could be a potential friend, how are you going to create new friendships? It's very difficult, it's very tough, and it's very isolating. And I know it was very isolating for myself. I don't think it was until I graduated, it took me 2 years to achieve my grade 12 diploma, that I was finally able to be confident enough to approach someone new and try to create a new friendship. And then there's a lot of risks in creating new friendships for people like us because we have a lot of character defects, we have a lot of behavioral symptoms. I don't want to make it sound crazy, but just being a stranger to my own self means that I have to learn about myself. I have to learn what I like. I have to learn what I like to enjoy. I have to learn what are my goals. What is my career that I want to get into? I have to learn how to walk again, basically. And then from walking, I have to learn how to run. It is very difficult, but along the way, I have to make sure that I'm stepping very carefully. And the same thing goes when I'm creating new friendships, because when I'm creating those new friendships, I don't want a friendship that could destroy my path. It's very easy for, as we know, being an ex-drug addict, for friends to influence you to do negative things. Drugs, alcohol, dangerous environments, being in bars, clubs. We have to make sure that we take care of ourselves, and we're aware of our surroundings and aware of the friends that we're choosing. Still to this day, I'm very cautious with the friends that I make, just for that particular reason. It's very difficult. Along the way, throughout all of these barriers that I just finished stating to you, there's labels that we pick up. There's labels that we pick up from being a drug addict, being as hopeless, homeless, being a criminal, being an addict, being a failure, being a drug dealer. Those too also cause barriers in employment or education or creating new friendships. And it's those labels that keep us bogged down. And it's hard to climb out of that ditch once we climbed into that ditch or we dug that ditch out for ourselves. And I think along the way, as we're growing into our confidence and growing through our successes and our achievements, we learn that we can do anything in this entire world. 2 years ago, I took on a huge challenge that was going to prove to myself, prove to others, to raise awareness, as well as to show that anybody that's in recovery, or maybe people that are searching for recovery, hence our fellow drug addicts, that you know what, there is a way out of this lifestyle. That journey I took on was a bike ride across Canada. I called it Riding for Mentors because we all need mentors for our youth. We need mentors for each other. We need to be mentors and positive people in society today. Now, to be an ex-crystal meth addict and to be nothing but a drug addict, to be a failure for all my life, to be hopeless and be homeless, to be a criminal, and to have police chasing me all the time, to take on a trip like this when I was just a few years in my recovery was huge. But you know what? It started with one day, hopping on my bike and beginning my pedaling along. You know what? I found my way across Canada. It took me 3 months and 22 days. See, it's stuff like that just goes to show that when we prove to ourselves that we can break through any barriers that we face, we can achieve anything that we want amongst our dreams. Doesn't matter where our dreams take us, it will take us somewhere, and it is positive. So today, I'm very proud that I'm here in front of you because with my history, I find that the most important tool is education. Education is most important because it's the most powerful weapon which I can use to change the world.
So I'm here to talk to you today about the Norlene Foundation's efforts to change the public discourse about addiction across the province. I'm going to start by showing you a representation that's pretty typical about addiction that you see in the popular media today. Addictions have long been considered a bad habit or a moral failing and not a health condition. That's because they're reliably associated with all sorts of social harms like crime, delinquency, child abuse, domestic violence, and homelessness. Given the remarkable rates of social harms associated with addictions, it's no wonder they've always been considered public safety problems instead of public health problems. But we now have a couple of decades worth of research that tells us that addictions are a brain disease, they are a medical condition, and we do know how to effectively prevent and treat them. We need to start telling this science-based story if we want to shift public thinking towards collective solutions to the problem of addiction. The trouble is, though, that when experts and researchers share their science with the general public, they often assume that the public will share their understanding about addiction and how it happens and what we can do to prevent this complex disease. But the mismatch between what experts believe and what the public believes is actually quite wide. And it's this mismatch that prevents the public from understanding and using this science to make the kinds of decisions we need to be making about policies and programs that can actually help resolve this issue. Now, why is that? We each have a murky swamp in our brains of cultural models and beliefs about particular issues that we use to think about particular topics. Human cognition is top-down, it's not bottom-up. So we process new information using general categories and these cultural beliefs. And it's when we try and reconcile new information with these beliefs that things can actually go awry. There are cognitive holes in people's thinking that if you don't plug with appropriate information, they will plug with other beliefs and even negative beliefs about a particular issue. So in the case of addiction, the public belief system about it actually interferes with their ability to think about addiction as a brain disease and think about addiction as something that can be solved with appropriate programs and policies. And we need to reframe that public belief system if we actually want to make progress in this area. So at the Norleen Foundation, we've been partnering with a nonprofit communications research organization called Frameworks. What Frameworks does is they specialize in translating scientific information for the general public. They've worked across the US, Canada, and Europe on issues like early childhood development, climate change, taxation, and immigration. Anywhere where there is a mismatch between the expert understanding and the public understanding of a particular issue. And what they do is they go to the experts and they say, you know, what is the actual expert story? What do we know about a particular topic? And they distill that down to the basic core concepts. And then they go out to Joe Blow public and they ask them, what do you guys think about this particular issue? And they map those two things and look at where the gaps are. And then they create something called a simplifying model, which is actually just a simple, familiar, mechanistic kind of metaphor that can be used to explain a complicated scientific concept for the general public that's consistent with the way that they can think about it and channels their thinking in ways that is consistent with that science. Then they go out and they test it with the general public to make sure that it works. So what I'm going to do right now is show you a short video of men on the street interviews that Frameworks helped us do here in Alberta. They were actually done in downtown Calgary that illustrates the cultural beliefs that Albertans have about addiction.
I want to start off by asking you, how would you define addiction?
That's a good one.
Addiction can be of any form.
People are addicted to watching TV, to shopping, drugs, smoking, cleaning,
Going to the gym, drugs, alcohol, sex,
It could be anything.
alcohol,
driving,
talking on the phone,
People constantly chewing gum.
alcoholic, drugaholic, workaholic, radical groups.
shopping.
Like good or bad too.
You can be addicted to your family.
Cooking, to reading. You got to be addicted to something that's good for you.
And some of them are addicted to the vodka and some of them to church.
When you're in absolute need of a certain substance, you cannot live without it.
I'm told that crack is, once you do it once, you're addicted to it.
You know, boom, it could happen.
I would define addiction as something that controls you
Control.
rather than you controlling the situation.
I find that they'll need it more than they'd want it.
Something you really need.
Need.
It's not a want, but a need.
You lose control over choosing between you need it or you want it.
You have the overwhelming desire to have it, do it, feel it, see it, whatever.
So what do you think causes addiction?
I would say depression. I think there's usually underlying issues that aren't being dealt with properly.
I believe it's a chemical reaction to your brain.
Outside stress. And to bury a lot of things.
I think sometimes it can be a chemical imbalance.
And you're down in the dumps.
Childhood.
Something that's happened in their childhood.
If your family has a history of addiction problems, you might be more susceptible to it.
I think there could be genetic predispositions.
There is a gene that's inherited.
Some people think it's that it's from your genes, but I haven't seen any proof yet.
I think a lot of it is the personality.
Personality.
You got to have an addictive personality.
Because of physiology and psychology
and mind, body, spirit.
People tend to go away from their spiritual side.
The devil.
I think at the beginning it can be just blind bad luck.
Then they must be a little stronger willed.
Like with willpower.
And really what don't kill makes you stronger.
Basically, it all depends upon how you control yourself.
Anybody can do anything they want.
I also think that it is a decision that an individual makes.
I think it's personal choice. I just think it's the easiest thing that's available to the individual.
So what you heard there were a number of the public beliefs about addiction which are not consistent with the science. First and foremost, the public thinks about addiction as being external to the body. It's like a dependence on a foreign chemical. But what the experts say is that addiction really happens in the brain, and it's those neural circuits that are fundamental in understanding how addiction happens and why addiction happens. The other thing you heard is that addiction is like an internal need state. And there was an overexpression and boundlessness. You know, you can be addicted to just about anything, but it better be something good. However, the experts say that addiction really results in a loss of control and impaired rationality. It's not about being addicted to anything under the sun. The experts also tell us that both genes and environments are really important in shaping the individual differences that we see in who is vulnerable to an addiction. But what the public believes is that addiction is really just personal choice, and that some things are in fact too addictive. And if you do them once, well, boom, you're going to be gone. And lastly, the experts say that evidence-based interventions are effective in treating addiction, and these interventions really should be administered early for long periods of time in order to have maximal effect. But unfortunately, the public still believes that damage done is damage done, and addiction is really incurable. However, you can control addiction with determination, willpower, and picking yourself up by your bootstraps. And this is certainly not consistent with the science. So what we've been doing at the Norleen Foundation is really trying to reframe addiction for the general public here in Alberta. We want to create, in partnership with Frameworks, a core story of addiction that explains why addiction happens and how it happens and how you can solve addiction. And we hope that by expanding that public understanding and the public beliefs about addiction, we can actually make an impact on things like public policies, service delivery, even on workforce training here in the province. Now, what I'm going to do now is give you a simplifying model that Frameworks has developed for us that helps to reframe addiction away from a problem of poor choices and moral failings and towards a problem that lies in the brain and a problem that can be prevented. For many children, the consequences of early adversity, such as poor physical or mental health or addiction, may be many years in the future, or if they're fortunate to land in strong communities, may not be triggered at all. Early negative experiences affect later development in the same way that fault lines sometimes result in full-blown earthquakes. Like a fault line in the earth, brain fault lines can form in a number of ways. In some cases, they appear as the brain develops, or they can appear over time as people experience stress without access to supportive relationships. Other times, people may have been born with brain fault lines, but just because there's a fault line doesn't mean there will be an earthquake. Brain fault lines are triggered by factors and experiences that turn them into earthquakes, which can do a huge amount of damage. We know that there are things we can do to help prevent fault lines from developing in the first place, and things we can do to minimize the chances that existing fault lines will turn into earthquakes. There are also things we can do once traumas or addictions have happened to prevent damage from happening again. So that, in essence, was the simplifying model that we've developed about addiction. And I'm going to show you now another video that showcases and illustrates people's response to this metaphor. So what happens is they're primed with this metaphor and then asked to talk about addiction within the context of this. And what I want you to think about while you're listening is how This kind of priming with this information really helps shift people away from the idea that addiction is a bad habit, that addiction is a moral failing, that it's about personal choice, and gets them thinking about addiction as happening in the brain. And the other thing to listen for in this video is how it can actually shift people towards collective solutions to addiction, things like policies and programs that can be implemented that can really make a difference.
Well, the fault line is I thought it was a good way to look at it, because it's kind of, you can see what's on the surface, but there's kind of there's those imperceptible changes that happen over time that eventually it comes to a head, right? And addiction, I think, is pretty similar to that.
So it's basically just a theory, and putting a fault line, say, in your brain to predispose you to addictions, like, you know, whether it's alcohol, drugs, food, anger, a sexual addiction.
If you have an earthquake on the earth, like, you know, Japan or whatever, things have just gone crazy, right? It totally destroys the infrastructure, which makes sense in terms of how the brain functions. If the infrastructure is destroyed, then it's pretty hard to function.
So these fault lines that I envision looking like mini earthquake lines, those can change as our stressors and things that happen over our lifetime.
And that is devastating because it would lead to addiction, whereas the fault line itself, left undisturbed, would lead to nothing.
The triggers that cause that final shift to happen are different in all these different fault lines. And so you could apply that to individuals. You could also apply that to different addictions, like whether interesting. If it's a behavioral addiction or an addiction to some sort of substance.
I think that makes sense that we all have in our brains at a neurological level, we might have those fault lines. But like you said, the trigger might be there for one person, it might not be there for another person.
Well, I would think if the trigger went away, then it would calm down. That fault line would calm down, and then there's less chance of it becoming bigger.
These fault lines can kind of develop. I don't think they always erupt into, they won't necessarily erupt into earthquakes. I guess I would hope that, that's where I think we need more counseling and more access to services, especially when kids are young.
How this could be valuable is once you can recognize that, then you can do preventative measures.
Because sometimes people just have the little fault lines, and that's it. And I guess that's the difference between an addict and a non-addict, right? So there you go.
Interesting. I like that.
Thank you.
So I hope you've enjoyed this presentation. I invite everyone to visit our website at www.albertafamilywellness.org to learn more. We are going to continue our mission to reframe addiction in Alberta, and I would invite all of you to join us in that. Thanks so much.
Come forward. There's always help. You're not alone. There's lots of help out there. It may hurt a little bit to admit to your friends that you've got a mental health problem, but you're not alone. Because in some ways it's bad to say that there's a lot of people with mental health problems. Some of it is transient, some of it is permanent. I have PTSD, post-traumatic stress disorder, and my psychiatrist tells me it's chronic. Now that's terrible, but it's not so terrible because he has been quite frank in my case and in other cases saying, you've got to live with it. And with some counseling and minimum medication, I am quite normal. I think the Circle can help quite a few people, or has helped quite a few people, and will continue to help people. Because as I mentioned, you're not alone. And once people realize there's help out there, there's help wherever you turn to. In the case of the Circle and the professionals there, both the clinicians and the volunteers, they're there to listen to you and help. And I beseech people to seek help because you're not alone.